Hey guys, Jill here from Ask a Vet Tech. Today we're going to talk about canine heartworm disease. And even though canine heartworm disease is a treatable condition, it is also preventable. If you didn't learn about it, you don't know anything about it. No fault of your own. So today we're going to dig into that and we're going to talk about why you need to know about heartworm disease, what causes heartworm disease, who can get heartworm disease, and how to prevent and treat it. Heartworm disease is carried by mosquitoes, a mosquito that is infected with Diphtheria immitis, and that comes from them enjoying some blood meal from an infected animal. Where would they get it? They could get it from any kind of wildlife that is a mammal and a canine species, or raccoons even. Can people get it? Yep, people can get it. It's very rare though. Not every mosquito that you see in the yard is infected, so make sure that you breathe a little sigh of relief for that. You're going to go in for an exam. They're going to take a small sample of blood from your pet, from the front leg generally, or the jugular vein. They're going to take this blood back into the laboratory and they're going to run it through a 4DX snap test or some other kind of heartworm test. There's multiple tests out there, but the IDEX 4DX Plus is my favorite because it tests for 4 different things. It tests for heartworm disease, Lyme disease, Ehrlichia, and anaplasmosis. Most heartworm tests just test for heartworm disease. So if you're lucky enough to have a clinic that uses IDEX standard as their laboratory, you're lucky. So once your pet has been diagnosed with heartworm disease, it is a good idea to just kind of take that all in. Your doctor will decide right away if treating the heartworm disease is number 1, or if we need to treat the symptoms that the heartworm has caused. Sometimes if your pet is really ill, we'll need to do treatment on the symptoms, such as the bloody cough or having a hard time breathing. Those are more important than killing off heartworm at this very moment. Sometimes heartworm treatment can take a few months to up to 6 months for the treatment to be completely done. It just depends on how ill your pet is to start with. Any way you shake it, heartworm disease is not great, but if you test for it and you're found positive, there's a few things that you're going to have to do right away. It is absolutely imperative that you get your dog into a crate and keep them as calm as possible from now until your doctor releases them for physical activity. Anytime that they need to go out and go potty, you need to leash walk them. Do not allow them to run free with other pets or into your yard or things like that. I know how hard this can be, and I understand that this is not what your pet wants, but this is what your pet needs at this very moment. It's going to be harder on you than it is on them. If they are allowed to run free, they could dislodge heartworms and it could kill them. Usually we're going to go ahead and we're going to start an antibiotic called doxycycline, and then we're also going to do prednisone. The reason we do the 2 is because you want to keep the dog comfortable, reducing pain and inflammation, and you're also going to want to prevent any infection that might happen from releasing these heartworms. After a few days of those medications, we're going to do an injection in the IV. At this point, your pet may need to stay in the hospital and have x-rays and ultrasounds to make sure that we're doing the right things for your pet. If during treatment your pet has been sent home with you, you need to make sure that you have a good contact information for your doctor or an emergency veterinarian just in case. After my pet has went through heartworm treatment, what's the next step? Well, at 6 months post the last injection, we're going to do another heartworm test. We're going to check and see if you're heartworm negative at this point. Potentially you could be, potentially you could not be. It just depends on the amount of heartworms that are in the pet's body. From this point on, your pet will be taking heartworm preventative and will need to be tested every 6 months just to make sure that we stay on track. The heartworm prevention is to keep them from getting heartworm again, and it is also to keep them from transferring heartworm to another mosquito to infect your other dogs and your neighbor's dogs and anybody else's dogs that come to see you. I really hope that I've cleared up some of the questions that you might have had about heartworm disease and the treatments and what to look for and all of that. If you have any questions or comments, please leave them below. I'd love to hear from you. If you haven't already, please subscribe. It really helps me out a lot. I want you to remember, I'm here for you. You're here for your pet. Have a great day.